just want to make mention first and foremost about how distressing premature ejaculation can be for some men who are experiencing it. Now, not all men are distressed by this, and as we're going to see in a couple moments, there's not really an objective way to really measure premature ejaculation by which we would go ahead and give somebody a diagnosis. Welcome back to another episode of the Erectile Dysfunction Radio podcast. Today is another solo episode, and we're going to be talking about premature ejaculation. This is a topic that we've been getting a lot of questions about, one that is oftentimes connected to, associated with, comes before or after or while experiencing erectile dysfunction. We know this topic impacts a lot of men and their partners, and we wanted to be able to do at least an overview of premature ejaculation, some of its causes, some of the misconceptions about it, and hopefully empower you, our listeners, to be able to better address this condition. So I just want to make mention first and foremost about how distressing premature ejaculation can be for some men who are experiencing it. Now, not all men are distressed by this, and as we're going to see in a couple moments, there's not really an objective way to really measure premature ejaculation by which we would go ahead and give somebody a diagnosis. So for those men, though, that are impacted by it, are seeking treatment, are looking for a way to resolve this can be a deeply embarrassing and distressing condition. It can lead to relationship problems. It can also lead to avoidance of wanting to date, wanting to be with a partner. Now, premature ejaculation has a technical definition of ejaculating from the point of stimulation in less than somewhere between 1 to 3 minutes, depending on which definition you are using. The way I generally tend to think about this, and I think there's pretty much growing consensus around the notion of 3 minutes for any form of stimulation and less than 1 minute for penetration, meets, let's say, a technical definition of one of the criteria for premature ejaculation. The other criteria have to do with distress. So what that means is that if you and or your partner are not bothered by ejaculation that happens in less than a minute, this would technically not be a premature ejaculation, as well as a sense of lack of control or loss of control. If that sensation is not present, meaning if your preference is to ejaculate quickly, one is I would assume that you're not distressed, but number two, if you don't feel a sense of lack of control, then technically this is not going to be considered premature ejaculation. Okay? Now, there is another form of premature ejaculation where a man is ejaculating more rapidly than he wants, and sometimes that is well over 3 minutes, but it is causing distress. A lot of times this is when there are changes from a man's previously known baseline. So if a man used to ejaculate after, let's say, 8, 9, 10 minutes of penetration, is now ejaculating at 4 or 5 minutes, while it is technically over that 1 to 3 minute mark, the distress that he is experiencing can be categorized as what is called a subjective premature ejaculation. And that in and of itself is a reason that some men seek treatment or seek to resolve the changes in ejaculation. Now, premature ejaculation has a number of causes. Some of them are physical and some of them are psychological. I'm just going to touch on some of the broader categories so we can help some of our listeners just make some broad sense of PE. So on the physical side, two primary drivers could be present among others, but primary drivers are a nerve ending sensitivity. So there are some men who seem to ejaculate rapidly in response to physical sensation. It is more common that this is happening with partner sensation. It is less common that it occurs with self-stimulation. And the other driving factor on the physical side has to do with levels of serotonin. So what we know is that lower levels of serotonin are associated with more rapid ejaculation. And I guess the better way of describing this is that the use of, let's say, a selective serotonin reuptake inhibitor, or an SSRI, has been shown to demonstrate a decrease in ejaculation. What we also know is that for men who are using SSRIs, they sometimes can experience delayed ejaculation or sometimes not ejaculating at all. So we know that the SSRI has an impact on obviously increasing levels of serotonin, which is oftentimes associated with slowing down or even preventing ejaculation. Again, these are two major physical drivers of premature ejaculation. There obviously could be other physical components at play. On the psychological side, what we tend to look at when it comes to premature ejaculation is an over-excitation, meaning that with sexual activity, often partnered, but it can also be with solo sexual activity like masturbation, a person experiences a escalating level of excitement. And we call that over-excitation because this person struggles to regulate their excitement, leading to a rapid ejaculation that feels out of control. The other major driver for premature ejaculation is anxiety. While these two really are working in opposite directions, overexcitation really means an abundance of pleasure, and anxiety means oftentimes an absence of pleasure and a lot more fear, worry, and concern. Both can be causes and triggers for ejaculation. What also could be like a little bit tricky about the psychological causes of premature ejaculation is that, in my experience, some men will be impacted by both overexcitation and anxiety. So I've worked with men who experience overexcitation with solo sexual activity, with masturbation. They also experience premature ejaculation with anxiety in a partnered setting. Sometimes what we do is we will try to decrease excitation to prove this theory a little bit further. And oftentimes by doing things like controlling the way a person engages in solo sexual activity, they have the ability to extend ejaculatory latency time. Now, there are different categories or different things that we would assess for when it comes to premature ejaculation. One of the primary pieces that we're looking for is whether the premature ejaculation is lifelong, meaning has it has existed for the entire time that a person has been sexually active, or is this what we call an acquired premature ejaculation? That means at some point in a person's life, they started to ejaculate more rapidly than they previously did. Right? Another thing that we're looking for is a person ejaculating rapidly in all settings, or is it situational? So there are many men who experience premature ejaculation only when with a partner. There are a lot of men who also only experience rapid ejaculation when engaging in particular forms of sexual stimulation, like penetrative sex, as opposed to manual stimulation from a partner or oral stimulation from a partner. Now, why does all of this matter? So the reason why this matters is because when we're trying to figure out what is likely to be causing somebody to experience premature ejaculation, and we're trying to be helpful, it is important that we have an understanding of whether this leans towards a psychological cause or if this leans towards more of a physical cause. So the more lifelong premature ejaculation is, and the more common it is that a person is experiencing premature ejaculation across all settings, the higher the likelihood that there is a physiological component involved. Okay? In the opposite direction, if a person has an acquired premature ejaculation, or if it is a situational premature ejaculation, it is far more likely, although not guaranteed, but far more likely that this person is experiencing a psychological premature ejaculation. Okay? Now, what are some of the treatments for premature ejaculation? So, if a medical doctor and or a therapist determine that a person's premature ejaculation seems to be a lifelong ejaculation, and it seems to be happening across all settings. Looking at serotonin levels, considering the use of an SSRI might be a more appropriate treatment. If there's concern about nerve ending sensitivity, one of the treatments that is offered to men has to do with what's called a delay spray. It is a numbing agent that is meant to decrease sensitivity of the nerve endings. There is some, I wouldn't call it quite a controversy, but there is what to be discussed about the use of a nerve numbing agent for a process that is really meant to be pleasurable. A lot of men do complain about the lack of pleasure with the loss of sensitivity that comes with some of these numbing agents. There also is a bit of a concern or a risk for men who are not using condoms that some of the numbing elements will spill over to a partner and very possibly inhibit the partner's experience as well. There are some products on the market that do claim to limit the numbing agent just to the person who has applied it, and their instructions will prevent it, or so they claim, will prevent it from spreading to the partner. So that might alleviate that piece of it, but I think each person has to make a decision about if they are approaching their premature ejaculation with the intention of limiting pleasure or in a certain sense numbing the pleasure components out, and if that is possibly going to create more of a performance focus leading to additional anxiety down the road. On the psychological side, so over-excitation is something that can also occur in the brain. It's something that can occur in a person's experience. And there are a number of ways, depending on how the overexcitation is manifesting, in which skills can be learned to better learn ejaculatory control. Also, just as a side note, for the nerve ending sensitivity, there are behavioral interventions that predate numbing agents that have been used successfully to varying degrees, and those are widely available online. And I certainly encourage anybody who is trying to grapple with what seems like a physiological sensitivity to try some of those exercises to see if they can gain some skill to learn better ejaculatory control, both from a psychological and a physiological desensitization process. When it comes to anxiety, so a lot of times there is a performance anxiety and anticipatory anxiety that triggers something very similar to the overexcitation mechanism, and that can cause a man to ejaculate rapidly. A lot of times when I see this type of anxiety, it is very situational. At times can be acquired, a lot of times it is not though. But certainly with partnered sexual activity, men can experience a rapid ejaculation from the onset of partnered sexual activity, and that can persist. I think what remains to be a question is for our listeners who have heard me speak about this very similar concept when it comes to erectile dysfunction. I am not aware of, and I don't think it is well understood or known, why it is that some men will respond to a performance anxiety to ejaculate rapidly, and why some men will experience loss of erection. Some of that may have to do with what the particular thoughts are that are leading to that performance anxiety, but in all likelihood, there probably is a predisposition, either by nature or nurture, that causes the body to react to that anxiety in different ways. There's a lot more to talk about on this topic, but I thought this would be a pretty good outline for any man who's experiencing premature ejaculation and is trying to make sense of it. It is confusing. It's confusing from a clinical standpoint, and as I outlined, the medical interventions are somewhat limited, and it really takes like some tracking and some assessment to determine, like, is this lifelong? Is it acquired? What are the situations where this happens? And for people to pay attention to what they're feeling. Are they experiencing an overexcitation and anxiety? Sometimes it's a combination of both. So hopefully this outline was helpful, and we will be doing some deeper dives into more specifics when it comes to premature ejaculation. And I'm looking forward to bringing you that information as well.